Dr. EB, CEO of My Dr. EB LLC, is a multi-award winning, board-certified radiation oncologist, consultant, international speaker, best-selling author, featured on NBC, ABC, Fox and Affiliates, and Hollywood Live. She has also led the establishment of radiation oncology centers nationally and internationally, consistently endeavoring to educate, edify, enlighten, and transform others through her practice. Dr. EB is renowned in her field for her innate understanding of cancer and empathy towards her patients. So please welcome your host of REVOXYLIFE, Dr. EB.
Hello, everyone. Welcome back to REVOXYLIFE with me, Dr. EB, on Bold Brave TV. I hope you are enjoying a lovely Saturday wherever Hello, this is REVOXYLIFE again with me, Dr. EB, on Bold Brave TV. Welcome. I hope you're enjoying your Saturday again, and I would like to commence the Big C as in Cancer Reattitude series. As you know, I practice as a radiation oncologist, and I have instituted a 7-pronged approach to treating cancer patients, not just using radiation oncology to ablate the cancer cells, but also to address the psychological toxicities that accompany the diagnosis of cancer. But not only the psychological toxicities, but emotional and spiritual. So the Big C Reattitudes was created and instituted in my clinical practice by me to address all the aforementioned issues associated with the cancer diagnosis. And the Big C Reattitudes is ascribed an acronym, HIS LAMP. That's HISLAMP. And you've probably heard me discuss this with Star Jones on the Marquise Who's Who video interview a few weeks ago. It should be on YouTube, and I have discussed this as well on many other interviews and also on Bold Brave TV. The H is actually for the restoration of hope. So the H is for hope. So the Re is actually the institution or the enactment of the element or the attitude. And then the attitude is itself the factor, the attitude that we want to instill with the Big C Reattitude. So again, the H is restoration of hope. The I is reclamation of identity. The S is the reaffirmation of self-worth. The L is the reappraisal of life. The A is requited admiration, as in patients admire us as physicians, and we admire them for the tenacity and courage, the strength it takes to endure radiation, chemotherapy, just the diagnosis of cancer, and to move forward in life nonetheless, facing all the other challenges that life presents to us on a daily basis. And then the M is the rehabilitation of the mind. The P is the reignition of purpose. And so his lamp, again, is a 7-pronged algorithm. And as us believers know, 7 is the number for completion, biblically or spiritually. So I thought that was very telling because indeed I have been employing these Reattitudes in practice because I was always impelled to do so as a cancer physician. It was not formally known as his lamp. It was not formally composed or presented in a fashion, whether written or in an interview debut. It was not publicized. However, I have been practicing using these Reattitudes for multiple years. And I was provided with the opportunity to publish and therefore disseminate this information in a formal fashion when Jack Canfield provided me with the opportunity to co-author in a book called Success. And that was the first presentation in a formal documentation, so to speak. And I co-authored the book Success, and my chapter was entitled Higher Ground. So the Big C Reattitudes was introduced first in that chapter, Higher Ground. Thereafter, an audiobook was published because I was advised by one of my very close colleagues, also a chief medical officer of a major hospital, that I should indeed produce the audible. So that is also available, and it is it is quite telling in so many ways, because I have found the big C attitudes to be extremely effective in managing my patients. Again, not just using the knowledge that I have amassed over the years in training, but collating the big C attitudes, instituting throughout the course of the patient's treatment. Because what we need to understand as physicians when we're treating our patients is that our patients come from different walks of life. And when they present with cancer, they have a certain narrative in their minds about how this will play out. They've already formulated an impression of what their life will entail moving forward. And many patients lose hope. Many patients believe that there is no brighter future for them. And so we, as physicians, treating just the cancer, we do not address all the psychological warfare, the ruminations and perseverations that are daily plaguing our patients' minds. And so the Big C attitude was instituted for that reason. Now, why is it that I was so impelled to institute such? What inspired the development of his lamp? And I have in the past expressed, explicated, discussed, revealed, divulged my path to my soul immunity, my discovery of the strength it takes to face adversities, which I have certainly endured in my lifetime. And I do believe that we are ordained to pursue a certain path, but to do so, we need to experience certain adversities. We need to endure personal experiences in order to be informed, in order to be inspired, so that we can assimilate, we can process the lessons learned from those adversities, but not just to edify ourselves, but indeed to disseminate to others. And that is indeed exactly what occurred in my life. And so I was then given a mandate, so to speak. As I've mentioned before, my goal is to partner medicine with the divine, and the epiphanies that we glean from these experiences, collating the divine interventions that I have experienced personally from my life with the expertise gained in medicine. I think and I know that that was truly ordained, and that is what, for the rest of my existence on this earth, I will employ in the clinical setting to not only treat the cancer, the physical cancer, but the tumors that are invisible in our patients, that we cannot see but are there. And we can always refer patients for spiritual guidance. We can always refer patients for psychological counseling. The issue is that patients do not have much time to do so because, of course, they are facing life. Most of my patients are working full time, and even if their workload is reduced, it is indeed uh, quite a very tough existence. And as we know, life is vicissitudinous. It's, there are ups and downs and ebbs and flows, and mountains and valleys. And so they're going through all that while being treated for cancer. So they do not have the time. Secondly, many patients do not want to be deemed as not strong enough and therefore needing psychological counseling. And many times we compartmentalize, we all do as human beings. So it is my belief that fusing the two, having the big C Beatitudes infused in the actual clinical practice setting versus separating psychological counseling, spiritual counseling from my treatment with radiation, my treatment of the actual physical tumor. I believe that fusing is indeed more effective. Again, because as human beings, we tend to compartmentalize. And so, in doing so, patients do not then fester, they do not develop this infection that is not being treated, the psychological infection that just festers and becomes an abscess that then is no longer, and I'm using an analogy here, a medical analogy, where an infection can then grow into or progress to become an abscess, which then requires a procedure to incise and drain. What we want to do is we want to address the infection with an antibiotic before it progresses to an abscess. And that is the analogy that I use when I state that I fuse the two. I employ, utilize, I implement the big C attitudes in my practice, along with the actual medical interventions, in my case, radiation, such that the whole patient is treated. And this, again, has been extremely effective, and my patients have many times, countless in reading my books, but also in practice. At the end of each patient's treatment, there is the tangible, if the patient does respond, and then there are the numerous intangibles that we discuss, so much that they have gained the collation of the culmination and collation of all of the amalgamations, tangibles, intangibles, big C attitudes, and treatment. We discuss them and we move forward. And even in follow up, we are still reaping the benefits. We are harvesting the institution of the big C attitudes. And so this is an introduction of the series of the big C attitudes: restoration of hope, the reclamation of identity, that's the I, the reaffirmation of self-worth, that's the S, reappraisal of life, the L, the A, requited admiration, the M, rehabilitation of the mind, the P, reignition of purpose. I hope that you'll be able to review this introduction. Until next time, we'll either be interviewing a guest, one of our honored guests, or we will be discussing the restoration of hope. These will be interspersed interviews versus the Big C Reattitude series. And in the latter, that is the Big C Reattitude series, I will also divulge, without, of course, any sensitive information, experiences that I've had with my patients implementing the Big C Beatitudes. So, until next time, have a wonderful weekend and a very, very lovely rest of the day, evening, or night, wherever you are in this world. Blessings always. This has been REVOXYLIFE with me, Dr. EB, on Bold Brave TV. Thank you for joining us.
This has been REVOXYLIFE with host Dr. EB. Join the conversation each week as ultimately Dr. Sophia Edwards-Bennett seeks to shift the perspectives and paradigm regarding cancer treatment, as well as educate the world on its matrices of adversities, right here, Saturday at 2 p.m. on the Bold Brave TV network.